Hi, Dr. Di Pasquale with NSI Stem Cell, and I'd like to talk a little bit about autism and autism spectrum disorder. Autism spectrum disorder refers to a group of brain developmental disorders that affect communication skills and social interaction to varying degrees of intensity. This has a significant impact on the patient and his or her family. While the mechanism and cause of autism is misunderstood or not quite developed yet, we do understand that there is a certain level of immune dysregulation and inflammation present in these individuals. And what it appears to be is an autoimmune disease for brain. I know that there are many other issues that are present, but ultimately that's the way it looks in terms of primary pathophysiological changes inside an individual that are creating symptoms. So when we look at this disorder from that perspective and we talk about how can we improve the health of this individual, well, there are two recent studies that we found, and essentially they found a link between autism and the immune system as well as the inflammatory process. One was published in Brain Behavior and Immunology in 2011, and it found higher levels of immune markers Th1 in children with autism. And one study in the Journal of Neuroinflammation in 2013 found increased chemokines, which are inflammatory signaling chemicals in children with autism, which basically shows the inflammatory component of this disease. In a regenerative medicine environment, we use a very different set of tools when we're attempting to affect an individual like this. This is an autoimmune disease, or it appears to be an autoimmune disease. And I think if we treat it in much the same way that we do our other autoimmune diseases where we have, dramatic improvements in patients' lives, I think we can affect individuals in a very positive way, or at least that's the paradigm shift. And that's the important thing to understand. Traditional medicine really doesn't provide a long-term solution for many of these individuals. And yes, we can do certain things to improve the condition, but we're met with, not a whole lot of improvement, or not necessarily what patients and their families are expecting in terms of outcomes. In this environment, we have a tool that can regulate immune function, that can decrease inflammation, and then we can implement the lifestyle measures that can help improve the condition on a grand scale. We know that autism patients have GI dysfunction. We know that they're going to be sensitive to specific foods. We know that there are behavior mechanisms that are going to affect the disease. And I think if we take a holistic approach and we use natural tools, we can really make a dramatic effect in patients' lives. And it gives individuals hope that there can be a solution or there can be improvement in the condition.